From Southern Fairfax, Senator Barker.
Mr. President, speaking to the amendment.
Senator has the floor.
Mr. President, I rise to support the amendment by the chair of the Senate Finance Committee, the senior senator from Henrico County. I think there are a lot of very positive things with this particular amendment that can provide significant benefits to Virginians in many different ways. I think everyone in here recognizes this is a benefit to health of Virginians, at least 250,000 people who are expected to be enrolled in the Medicaid program if we do this expansion. It's a benefit to Virginians in terms of life expectancy, because those people who are uninsured and don't get care, who don't get the preventive services that the senior senator from Norfolk talked about, have significantly lower life expectancy. It's a significant benefit to those people with mental health services, many of whom are in this category, in effect are in the category because of the mental health services that they need. It's a significant benefit to the providers that operate in Virginia and that have actually done a very good job in many respects in taking care of the uninsured, but who will suffer substantially if we don't do this, because they will still get substantial cuts in funding in other ways, and will actually be worse off as in many situations in which they are already precarious, as the senator from Franklin referenced. It provides benefits, this amendment does, in terms of ensuring that we reform our Medicaid program and that we continue to do it. We're not a Johnny-come-lately to come this. Over the last 3 years under Governor McDonald's administration and the operation of Secretary Hazel, we've made a number of reforms in our Medicaid program, and this will help continue us on that path to make it a more efficient system, and we do expect to be able to get waivers from the federal government to move forward. But beyond those types of benefits, I think it's important that we understand this is good for Virginia in a much broader way. It is good for Virginia's economy in terms of the operations here and the infusion of additional money that will help us in many ways. It's good for Virginians, as several speakers have mentioned, in terms of the jobs that will be created. It's also a very significant pro-business measure. Several speakers have talked about the fact that Virginia businesses pay a premium when they buy insurance now, because they have to cover that insurance they buy pays for the cost of health care services for their employees, but also pays a significant premium to, in effect, provide reimbursement to cover the cost of the uninsured when they show up at the emergency department, when they need to be hospitalized, when they need a variety of other services. If we do not expand Medicaid in Virginia, while surrounding states are expanding their Medicaid programs, Virginia businesses will be at a competitive disadvantage, because the businesses in those other states will not be having to pay that insurance premium that the businesses in Virginia will pay. And finally, as to the issues that's been raised as to the amount of benefit that we get in terms of federal dollars here, I think it's important to understand a couple of things. One is that any time we want to opt out of this program, should the federal government change the share to where we would pay more than 10%, we have the complete flexibility to opt out. The Supreme Court made that clear with its ruling last June. In addition, the senator from Hanover talked about the fact that most of our Medicaid recipients and most of our Medicaid dollars now are paid for on a 50% state basis and a 50% federal basis. That means for every $1.70 that we get in federal money for those things, we put up $1.70 in state money for that. Now, for those children who are on the FAMOUS program, and on that we provide only 35% and the federal government pays 65%. It's enhanced reimbursement, just as is proposed in this program. There were those who were concerned when this was passed in the mid-1990s to whether that was last. It's been in place for more than 15 years, and it continues to be at that same rate. For every $1.70 the federal government puts up for our FAMOUS program, we pay $1, significantly less than the $1.70, but $1 nonetheless. Under this program, between 2014 and 2022, every $1.70 the federal government puts up, we will pay a penny. $1.70 in federal dollars, and we will pay nothing more than a penny over that entire period of time. How we could reject this when we know it's good for Virginia businesses, it's good for the citizens of Virginia, it's good in terms of health care services, it's good for our providers, and we're going to continue to move forward in Medicaid reform to make sure that it operates well long term. I think that it's something that we need to do, and I hope that we adopt this amendment today.
Thanks, Senator.